Oh, beautiful. So today with Regenerative Health Medical Center, we are discussing the gut. So there has been a lot of notoriety about parasites. So the title of today's webinar is going to be Think Gut Tests Are Just Looking for Parasites? Think Again. This is presented by Dr. Aram. I am Dr. Aram, a naturopathic medical doctor here at Regenerative Health Medical Center. I also have my degree in counseling. And to be honest, that has given me a lot of benefit when working with gut patients because gut is a lot about lifestyle, and there are some psychological blocks to when people feel that certain foods may cause reactivity in terms of how the gut-brain connection works. So some of that stuff does come into play. So my counseling background when discussing treatment options or investigating the cause of gut-related issues. But ultimately, what we're really focusing on today is looking at what different types of gut tests we can employ beyond just simply looking for parasites. That is kind of the theme. So let's move to the next slide. So why are we talking about parasites? Well, if you've been up to date with what's been going on in our national health this summer, we've had quite a bit of food outbreaks. I think the most recent foodborne illness that really started the wave of attention is the cyclospora outbreak. That is going to be a parasite that has a bit of a longer onset in terms of when symptoms develop, normally about 2 weeks or so after. And very profuse, challenging diarrhea can be the symptom. While outbreaks happen every year, this outbreak was a bit larger than what we're used to, actually quite a degree larger. And since then, we've seen some other incidences like the salmonella outbreak that's been related to eggs. I think the most recent report I saw, there was a location in San Diego that was thought to be the source of the outbreak, but these are, excuse me, these are ongoing investigations, and generally speaking, it's important for them to do their due diligence to track in order for recalls. But staying current, staying up to date on what foods are high risk, lower risk is honestly really important for a lot of gut patients because post-infectious IBS is a real condition. And I have seen individuals who never really struggled with gut health really take a turn for the worse in their health after having a bout of foodborne illness or stomach poisoning. Now, finding parasites is important. It's a real and valid part of gut investigation, but it's not the only thing we can investigate. Modern gut tests go a lot farther and deeper than that. What you might see covered by insurance, run by your general primary care doctor, tends to be focused on that parasitic infection. And to be honest, cyclospora, for example, isn't even routinely investigated. So you can request some of these parasites to be looked into with a stool test through your provider, through insurance. But in California, we're naturopathic doctors. We don't take insurance. We have opportunity with some insurance plans to use copay to make some of these gut tests more friendly, cost-wise. However, the depth of information is almost incomparable to what you're going to be getting. You We're not just looking for parasites. We are looking at the whole ecosystem of the gut, and we're going to dive into what that means throughout this presentation. So, what do you think we're looking for? Well, we could be looking for parasites. What is the organism that's making me sick? Or is there a bad bacteria in there? Is there some microbial that snuck its way into my gut that shouldn't be as abundant as it is? A lot of times we're just thinking we're looking for a positive or negative test, much like if you were to take an STD test, coming back positive, negative, we know what it is, we treat it, we go on. And sometimes it can be that straightforward, but oftentimes the gut is much more complicated than that. So we need more complicated measures of looking at the stool, breaking apart the different microbiota as well as inflammatory factors, and all this great data that modern stool tests and other gut tests can provide for us. So, one key concept here, I want you to think about finding the bad guy is only part of the investigation. Let's take ourselves outside of this realm of gut health or medicine in general, and let's think of a neighborhood. And this neighborhood has been dealing with a robber. Robber has been doing an excellent job at what robbers do, and they're taking resources and causing trouble and really just making it a hard place to feel comfortable and safe to live in. So obviously stress goes up, and people are a little bit more conservative and trying to hide their funds, hold their funds. The robber's been out taking advantage of anyone they can take advantage of. And sure, we can put the robber away. We can get the investigatory cops and get the police on top of them and make sure that we remove the potential insults to the neighborhood. But what if that insult comes back, either in a different form, disguised, wearing a different hat? And what if it keeps coming back? No matter how many times we get rid of the robber, there's still crime. At that point, we got to be asking ourselves, what is going on in that neighborhood that's allowing so many robbers to arise without any kind of regulation, without any kind of system put in place to defend against this kind of insult? Now let's go back into the medical field and let's consider that these pathogenic bugs, these parasites, that's kind of the who of in terms of what we're talking about. Yes, of course, there is that in terms of what we're looking for in the gut, but we also can be looking at what is making the system vulnerable. Is my stomach acid strong enough to actually neutralize any of the bacteria I'm exposing? Because that's first line, right? The oral is our first exposure, but after the oral, we're going right into the whole digestive tract, and that stomach acid is going to be our first line of real defense against pathogenic bacteria or even bacteria that don't inherently cause issues but can overgrow and take up space from the good bugs. So we got to be thinking about what's making our defenses struggle. What conditions are allowing these problems to persist? Is it inflammation? Is it an immune system regulation problem? There are a host of different reasons as to why our gut as a system can be made a little bit more vulnerable for these bad guys to come in and continuously insult our body, continuously challenge our health. So I really want you to find confidence in that your gut was designed to defend you. And if symptoms keep returning, maybe we need to investigate more than just the latest bad guy. And that's kind of transitioning away from hyperfixation on parasites and expanding to more of the terrain. What is going on in my body that's actually allowing my symptoms to persist. All right. So does this sound familiar? I want you guys to ask yourself, have there been periods of my life where I've gone through some of these symptoms? Is this describing me right now? Are we bloating after meals? Are we struggling with any form of gas, constipation, diarrhea, stool changes? Oftentimes I see patients come in with chronic gas and they will have maybe not diarrhea, maybe not constipation, but they'll have these snake-like bowel movements, these very skinny, clearly occluded type pictures of their stool coming out due to the fact that their gut is so inflamed, is so full of gas, there's no space for the stool to properly form. And what happens when we can't form a nice, robust size to our stool? Well, it's going to be sitting in the gut a little bit longer than we'd like, and fermentation might be happening. Bouncing back and forth between constipation and diarrhea may be occurring. There can be a lot of struggle to the gut when it doesn't know how to properly void. And gas and bloating after meals can be a big part of, unfortunately, training the nervous system to not have a smooth regulatory movement the way we'd like to. Most of us, we should be going at least once a day, if not twice, sometimes three times a day, depending on our motility, depending on the volume of food we're eating. But realistically, it's a major detox pathway. So if the gas and the bloating after meals is getting in the way of our ability to void, that can be a big problem. You may also find you're someone who struggles with reflux after meals or abdominal discomfort in general. Distension is fairly painful at times. We can get so bloated that there's pain, there's discomfort, but then there's also sometimes that heartburn pain, that chest pain that we're feeling. Food sensitivities, food reactions. Maybe you're not gluten intolerant, but you're gluten sensitive. The amount of individuals I see who come to me looking to heal their gut and they find that they have food sensitivities or food reactions that aren't a straight allergy or a straight contraindication that tells me that their body is struggling with the introduction of that food particle and reacting to that food particle, but perhaps not enough to cause full-on anaphylaxis. That's that sort of gray area that I find functional medicine does a wonderful job of identifying and treating and putting people in remission, almost to the point that sometimes we can reintroduce those foods when the gut has been fully healed and prevent those reactions from occurring. There's also the unpredictable digestion. Sometimes I eat this food and it gives me problems. Sometimes I eat a food that is always clean for me, and now I have problems. It can vary, and that can have something to do with the mind and the body and mental health in terms of how our gut and brain are connected, where our headspace is at, where our stress levels are at, but also eating hygiene. And sometimes we don't even realize that what we're doing in terms of how we're eating is really affecting how we're digesting and breaking down foods. So there's also a good a bit of eating hygiene or diet hygiene that we can incorporate into our treatment plans that allow for a more optimal environment and more optimal digestion, thus taking some of the burden off the gut so that we can put more resources and energy towards healing and not so much catching up the lack of digestion that can be occurring. So this kind of visual right here is to discuss the gut health merry-go-round. This is some cycle that I see often in gut patients. Maybe they come in with bloating, and after bloating, they notice a change in stools. So they're feeling like they have to start avoiding foods. And there could be some temporary relief, of taking out the insulting food. I should be good to go, right, doc? Well, now I'm tired. Why am I tired? Well, maybe you're avoiding carbs altogether because you're worried that you're feeding yeast. Maybe you have eliminated the ability to have the fiber that helps you feed your gut bacteria that leads to all types of wonderful postbiotics. The material that is broken down by your microbiota called postbiotics can provide a lot of great benefits, be it improving your gut health, improving your brain function. Sometimes when we're avoiding foods, we restrict ourselves from eating the foods that feed our good bacteria, and that can result in fatigue. That's one cycle, and at any point in the cycle, we can go back and forth, as shown by the visual. I probably should have included that with the arrows. Sometimes we go from bloating to change in stools, and the change in stools leads to fermentation, which leads to more bloating. So these merry-go-rounds can go clockwise, counterclockwise. They can be fairly exhausting for patients to feel like they're kind of going through that same cycle without remission. Another cycle might be sort of learning to avoid the foods that bother you, resulting in a fear of going out. You don't want to go to restaurants anymore. You don't want to go to your friend's place and eat their home cooked meal. You don't want to offend them by avoiding certain foods they've made. And that can sometimes also feel a little bit isolating or alienating. You feel left out of cookouts, or you feel like the dessert that everyone made, everyone's enjoying, but you can't quite have it. And that can be exhausting too. You always have to have a plan, and you're always strategizing and thinking as to how can I avoid my food and my gut symptoms, really. And this can lead to a lot of trial and error, and throwing a supplement here, throwing a probiotic there, and never really knowing what the underlying reason is. And that in and of itself can be exhausting. The amount of patients, gut patients, non-gut patients that come to me, and then when we come with a diagnosis and we feel confident that we know what's going on, even if it's a pretty serious diagnosis, there's a sense of relief and sense of understanding that the patient has after coming to a diagnostic conclusion that in and of itself is medicine. Being able to know what the problem is and label it and understand it can be a huge relief for patients. So I empathize with those who are in this merry-go-round, in this cycle, and are kind of guessing at what's going on. And without a proper test or a proper stool evaluation, they're really just spending a lot of time seeing what sticks on the wall, and hoping that that sticks for the majority of the rest of their life, the rest of their symptoms. But that's not always the case. Sometimes we need to change our strategy as our system and as our lifestyle changes as well. So really, what we're asking, but why are you having this? Why are you having the symptoms? So some key insights. Right here, I want you to know that your triggers, they're not the same as knowing the cause. That's kind of what I was alluding to before. So, I know what food bothers me. That is useful. People who do diet diaries, patients that already come in, having that information on hand, very helpful, very wonderful, can definitely fast track my investigatory process. But ultimately, I might have three patients, person A, person B, person C, and they all might start off with the same thing. Eating makes me bloated. Eating makes me bloated. Eating makes me bloated. And I'm thinking, okay, this is the same symptom, but is there a different reason? I'm not going to know until I ask more questions. So, really, let's look at person A. Eating makes me bloated, but I cut out all the food triggers the internet told me to avoid. Okay, that brings my mind towards one direction. Maybe they've come in and I'm thinking they have a dysbiotic picture, they have low stomach acid. They say eating makes me bloated, but I take a probiotic and tried apple cider vinegar to help my digestion. Perhaps the digestion isn't coming from low stomach acid, but coming from low pancreatic output. And digestive enzymes is more of a beneficial opportunity for them to actually break their food down, as opposed to increasing the stomach acid potential from an apple cider vinegar product. Maybe the probiotic was the exact thing they needed, but it was the wrong strain or the wrong dose. Or it was an inferior product that has been sitting on a shelf in a standard Walmart or Target, where they might have been needing something vetted by third-party companies, something from a online dispensary that's used by medical practitioners to make sure that patients are getting live and beneficial probiotic material. And then person C might be coming in saying, everything makes me bloated, but I tested negative for SIBO, and my doctor says I have IBS, and it'll probably be there the rest of my life. IBS is a diagnosis of exclusion, so I understand the rationale in going there, but really, until I've exhausted all my possible medical reasons for having disrupted functional gut flow, I'm not going to be giving a functional diagnosis like an IBS. I'm going to be thinking, what can be going on in the body that is driving the symptoms. So this is just to highlight that same symptom can potentially come from very different reasons and have very different stories. And having these longer intakes, like we do in Regenerate Health Medical Center, really allows me to put on my investigatory hat and think about what is driving this case, what is driving this individual's symptoms that may seem very similar to a wide variety of patients I've seen, but the story as to how they got there and what's persisting their symptoms is unique to them, and their path out of there is also going to be unique. So let's reframe what we're thinking with the gut. Oftentimes, the gut can be thought of as a glorified tube. I would akin it much more to an ecosystem, a forest, something that is alive and breathing and adapting. It has a host of roles. It is working with digestion, absorption, motility, microbiome, immune function, inflammation, as well as an intestinal barrier. All those are key components to what makes a ecosystem in the gut a healthy place that's going to function well. So gut health, depending on an entire ecosystem working together, is a gut health that I'm going to see have long-lasting results. Not just simply giving you more absorption when you might also have a motility issue, not just properly toning down the immune function if there's also inflammation there as well. We really want to be thinking of the whole system and thinking how the gut is functioning. Well, that's essentially what this slide is about. That digestion is what's breaking down your food. It's what's allowing you to absorb what you need. That motility is moving things appropriately. Being mindful about the parasympathetic and sympathetic nervous system is really important for motility. So this is the kind of area where we're talking that goes beyond just simply thinking on the gut and what it's doing to break food down. But what is our nervous system doing? Because when we have strategies to get more motility, sure, I can give you a supplement that is full of artichoke and ginger, and there's good research behind it, and we have the proper dosage and time of day when to take it. But can we also just utilize what your body normally does on its own? Can we create more space between meals so that we get that motility going? We have a thing called an MMC, or migratory modal complex. Motor complex, sorry. The MMC is designed to create peristalsis. That is the contractions, that is the churning and the moving of the stool through the gut. So when we have space between meals, for example, someone who snacks throughout the day, they have maybe one real meal, but three or four small little snacky meals throughout the day, they're probably going to be having a lot more late digested food, impacted stool. They're not going to be moving their bowels as fluidly as someone who's spacing out their meals morning, lunch, and dinner, maybe a snack in between to get them through the stressful part of the workday. But really, having a good amount of space in between meals allows our body to go from that digestion and breaking food down and absorption into mobilizing and moving that stool. Because at a certain point, we've gotten what we've gotten out of those nutrients. And we got to start moving that stool out as the toxic burden that it is. And if we aren't giving proper space in between meals, we're really disrupting that MMC, that migratory motor complex, and not allowing things to move through. And parasympathetic nervous system plays into that, because when we have our parasympathetic nervous system, our rest and digest nervous system engaged, blood flow comes to the gut. It comes to the place that it needs to break foods down, to move food along. Whereas if we're in a sympathetic state, we're highly stressed. We have that metaphorical tiger chasing us. that's when all the blood flow goes to our extremities and it moves away from our gut and it moves away from digestion and more towards mobilization of muscles and recruitment of oxygen to those peripheral tissues so that we can run away. Now, that metaphorical tiger is more likely just stress coming from work or whatever situation might be causing that sympathetic nervous system response. Fortunate, most of us are not running and fighting for our lives like our hunter-gatherer ancestors were, but we are working with the same hardware. So we have to think in terms of metaphors sometimes and think, what is that stressful lingering in the back of my mind or deadline that's pushing me to rush through my food and rush through my lunch? Am I taking deep breaths before I eat? Am I taking a moment to just calm down and look at my food, smell my food, appreciate where the food came from? Things like mindful eating, wonderful exercises to get us more engaged in that parasympathetic nervous system prior to ingesting our food. So anything from spacing our meals out, engaging in 12-hour fasts, because that gives our stomach some time to actually recharge and repair and move the stool through, or just working on eating hygiene. Those are all different strategies that help with motility, which, I mean, see how long I've been speaking on motility. That's just one component of the functionality of your gut. There are plenty and plenty of things we can cover in a comprehensive visit about how to optimize your gut that may not even include a supplement, or maybe bolstered by a supplement. Speaking of supplements, sometimes that comes in terms of creating a healthy microbial ecosystem. That can be anything from introducing a probiotic to introducing polyphenols, things that help the microbiota that are already in our ecosystem communicate cell to cell with more ease, more functionality. Sometimes we have enough of the good bugs in there, but they're not speaking to each other the way we'd like them to. So that's when helping the ecosystem and the communication between the cells and making sure that we're having the right proper growth is all part of the plan. So it's not as simple as just introducing the right probiotic. It's also about giving you the right foundational pieces so that probiotic actually lands in the gut and starts developing and propagating itself. So you get all the beautiful benefits that may come from a short chain fatty acid producing bacteria or a bacteria that helps with our gut mucosa. And that also comes from defending against unwanted organisms. So that kind of was alluded to with the stomach acid. Is our stomach acid strong enough to break down any possible pathogens we're being exposed to in the gut? We really want that stomach acid strong enough to break down food, but also to protect ourselves from bacteria entering that small intestine and causing issues and propagating itself in places it shouldn't. So we're also trying to regulate immune activity in the gut. The gut uses different types of immunoglobulins. A lot of our IgA is found in the gut because it is a mucosal immunoglobulin. These immunoglobulins are utilized in order to enact proper immune function and to kickstart the immune system. However, if we aren't necessarily high enough in these immunoglobulins, we may be dealing with a very vulnerable gut microbiota. And if we have too much of a reaction from our immune system, that's when we can get a lot of these food sensitivities or inflammation can be driving up the wall. And we really have to tone down that immune activity before we can really stitch the gut up and heal the tissue. And speaking of healing the tissue, that's also the discussion on maintaining the intestinal barrier. So this to say, the foundation of the gut has a lot of components. And when one part is struggling, another part can be affected. So moving along, this is really when we get to the meat of the presentation. The right plan starts with the right questions. So your symptoms tell a story, but an in-depth naturopathic medical intake helps us understand that story and identifying the questions that matter most for your gut. That's going to lead to identifying the right tests for your gut, the right treatment plan for your gut. So we'll start with your story, some symptoms, history, any patterns we've noticed. Diet is obviously huge. And from the right questions, we can identify what deserves a closer look because we can go in a lot of different areas. So really being able to be succinct and mindful of what is the most prudent question to ask is important for treating the gut. And from there, we might be ordering tests, blood work, stool tests, whatever it may be. But we'll find a plan that fits you, not just fits your symptoms and your body, but also your lifestyle. Are you a single parent that doesn't have time to cook for themselves? Are you an individual who has a very particular diet based off of maybe religious beliefs or based off of just what other people in your family eat? So I've seen plenty of families that have celiac related family members that choose to go celiac, just so that everyone in the household knows that there is no possibility for gluten to be involved. And that can change the treatment plan that I'm going to be implementing. So really being person-centered is where I find the beauty that comes from these functional medicine, naturopathic medical intakes that generally are anywhere from 60 minutes to an hour and a half long. It really lets us ground ourselves into the patient and what's going to work best for them. So, speaking of specific questions, we can start with question one. Are you actually digesting your food? A gut test can really tell us a lot about how you're breaking your food down. It can be showing pancreatic digestive function. Is your body producing enough digestive enzymes to actually break down the carbs, the amylase that breaks down carbs, the protease, it's breaking down the proteins. We have a host of different enzymes that the pancreas's job is to release into the gut. Pancreas is obviously working on insulin, but an entirely different structure and tissue within the pancreas is designed to build up that digestive enzyme and then release it into the small intestine early on, exposing the food into proper enzymes that break down these different macronutrients into something that is usable for our body to use as fuel, to use as energy, rebuilding our tissues. All of that is important for functionality of our gut. Fat digestion and absorption, are we getting enough bile flow? Are we really seeing fatty stools? Sometimes we don't even need a gut test to know this. We might see some oily, greasy stools. And this isn't everyone's favorite part of being a gut patient, but I encourage you, even if you aren't having gut symptoms, to at least occasionally take a look at what's coming out when we void. It's something that is not a practice everyone does, but especially those who are health inclined, wellness inclined, there's a lot of good information that can be had from looking at our stool. And with the rise of colon cancer and a variety of other gut issues like, IBS, IBD, it's important for us to spend some time checking the regularity, consistency, color, nature of our stool. Like I said, is there fat molecules in our stool? Is there mucus? Is our stool floating? Is there blood? These aren't the most sexy questions, but the data we can get from them are amazing. So if you're one of those people that's already doing that, really great. That's a great habit to have. If you're someone that needs to think about how they can occasionally be spending some time to look at what they're voiding before they flush the toilet, please, I encourage you to do so. It's a great practice for your health. Your provider will really appreciate that. So overall digestive efficiency, that is another clue that can be made from the gut test, from any routine stool test that we run here at RHMC can tell us a lot about just our overall digestive efficiency. So digestion is a very important piece. A big one that I see is inflammation. Are we seeing inflammatory markers go up? Tests like Genova's GIFX, one that I like to run. We have a 3-day collection. We have a 1-day collection, depending on how motivated you are to get different samples. But this test, be it you doing a 1-day collection or a 3-day collection, is going to tell us a host of different inflammatory and immune markers. Calprotectin, eosinophil proteins, secretory IgA, that immunoglobulin that works with your immune system I was mentioning, fecal occult blood, that is huge. This is one of the biggest signs that we might need an earlier colonoscopy. I might have a 32-year-old individual who comes in having no idea they have blood in their stool, and they're not even due for a colonoscopy because they don't medically qualify without a aggressive family history until they reach that 40 to 45 age, depending on coverage of insurance. But really, what I'm saying here is that doing a stool test and seeing evidence of fecal occult blood, that blood in the stool that you can't visually see but can measure with a lab test, might lead me to be a lot more persistent in taking a real visualization of the colon, of the small intestine, to make sure that there isn't anything more severe going on. And if there is something more severe, we're going to catch it early and we're going to treat it early and get you into a really good remission-based state before any real destruction or damage can occur in the area. So again, some of these gut tests can also be preventative as opposed to just dealing with someone who's actively symptomatic. But inflammation is something we can investigate and definitely something we can treat given the right plan. Question three, what is your gut immune system doing? The gut is housing a significant portion of your entire immune system. Modern testing can provide a window into mucosal immune activity. I mean, how many times have you guys gone to a naturopathic doctor or any kind of functional medicine doctor and they ask, how many courses of antibiotics have you had? We're not just asking for fun. We want to know how many times have we functionally wiped out our entire gut microbiota. And that's not always the case. Sometimes we do a little bit of a shorter course of antibiotics, or maybe not as aggressive as a gut damaging antibiotic. But realistically, we need to know that data so that we have a good sense of potentially how much compromised immune activity is coming from the gut from previous antibiotic usage. So we can see, is the immune system still being stimulated, that high secretory IgA? How is the intestinal immune system responding? Are the gut's defenses functioning appropriately based off of what it's been exposed to? And we can see anything from high secretory IgA to low secretory IgA, where essentially the mucosal defenses are underperforming. Excuse me. And we are maybe even seeing that occur when there's no pathogen detected. So sometimes I'm a little concerned that a low secretory IgA is coming from a previously high and overexhausted secretory IgA. But if I do catch secretory IgA being high and there is no pathogen detected, I'm really thinking about that terrain theory again. What is going on in the environment of the microbiota that is leading to this immune response? Because something is happening, and it might be something as simple as a leaky gut. Things entering spaces in the gut that they normally shouldn't because we're losing some of those gap junctions. And we are going to dive into that with a little bit more detail later on in this presentation. This is one area that I've been alluding to and want to just spend some more time kind of breaking down. Who is living in your gut? This is what I mean by your microbiome is an ecosystem. We have that beautiful canopy of the forest in the background. The more we think of ourselves as not just an individual, but an individual comprised of many different parts, a big part of what we're made of is a microbiota, is these bacteria that are inside of our guts. It's not always the most pleasant thought to think of, but they're doing a wonderful job keeping ourselves healthy, keeping our guts healthy. So what you'll notice here is I highlight commensal organisms. What are commensals? These are the organisms that coexist as part of your gut environment. Some of them are widely beneficial. Some of them are mainly nice because they take up space and don't allow these opportunistic or even pathogenic organisms to take over and really grow and utilize the foods. Because if you think about what we're feeding our gut in terms of the fibers, the prebiotics, these things that fuel the microbiota, if you have some bacteria in there that aren't beneficial for you, even if they're not harming you, they're taking up some necessary resources. And that's what I mean by moving from commensal to opportunistic. If we can think of these as street lights, like traffic lights, think of the commensals as green light. Beautiful. We love them. Keep the green light going. Everyone likes to hit the green light. Just keep me moving, get me to my destination. Opportunistic. Okay, now, we might need to take a pause here because opportunistic doesn't necessarily mean they're causing harm, but they could be doing two things. They can be, like I said, present, taking up resources, occupying the physical space in the gut, not allowing the good bacteria to really work as optimally as you'd like. But they can also be something that eventually, because of a shift in gut ecosystem or a decrease in some commensals, maybe from an antibiotic that took out some of your commensal organisms, they can go from just sort of hanging out and taking up space to actively harmful. So that's what I mean by yellow light. Just because they're in the gut doesn't mean they're the source of what's causing harm. But I'm suspicious. I'm looking at them and I'm wondering, how much are you contributing to the symptomatic nature of my patient right now? And then we're going to go into this in the next slide, but the red light would be pathogens. We don't want to see those pathogens in there. We don't like them in there. They are causing issues, likely driving a lot of our symptoms. So that's kind of that traffic light analogy I think of with the commensal, opportunistic, and pathogenic organisms in our gut. Keystone species. These are organisms that play a critical role in the ecosystem. Next slide, we're going to unlock some of those. I also want you to pay attention to microbial balance and diversity. This is going beyond just, what bacteria are in there, but thinking of it from a balanced standpoint. Do we have a lot of this family? Some of these gut tests do a wonderful job of breaking down the different organisms in our gut based off of the families they belong to. And certain families are really abundant in those who eat a lot of proteins, animal proteins, meats. And some of these are also really abundant in those who primarily focus on nuts and fruits and veggies. And obviously, a patient's report on their diet can tell us a lot. but really the gut test is what's showing what's propagating and landing in in the stomach. And people can sometimes be unreliable narrators. So getting a gut test can really allow us to question our biases when I think, no, I eat plenty of fruits and veggies. And then I look at my gut test and I say, hmm, then how come I don't have any bacteria that are propagated from fruits and veggies? Perhaps our intake is lower than we once thought. So this is expanding on the previous slide, but just highlighting commensal organisms. I've listed a few here. You would likely see these all on any of these gut tests that we're going to talk about later today. But you can see some of the foods that help support the growth of these different commensal organisms. You know, these oats, these legumes, these whole grains. We can really be pretty specific in terms of what foods we want to increase if we do see some commensal organisms not at the adequate levels we'd like. Also for opportunistic organisms, I listed some of the issues that may arise when they turn from opportunistic to more problematic. We might see inflammatory signals and mucosal disruption from a patient that has high Klebsiella levels, Enterobacter, or even Enterococcus, just taking up space, that gut colonization. It's sort of like, hey man, can you get out of the master bedroom? This is where I sleep at night. Well, I mean, you're a guest here, so go to the guest room. It's like, why are you taking up so much space? So that's one thing to consider. Keystone species, Akkermansia, mucus layer and barrier support. You may have been hearing Akkermansia and even seeing the probiotics being marketed. One, because they have finally found ways to make sure Akkermansia is stable. For a while, these supplements weren't as well tolerated and would essentially not necessarily propagate the gut. But we have seen some improvement in manufacturers' ability to create a proper Akkermansia supplement. Why is it getting a bunch of news and attention in the social media spaces, in the health and wellness spaces? Well, it's because it works as a propagator of a protein that is akin to a natural GLP-1. So patients who have higher Akkermansia levels may correlate with having better blood sugar regulation. And that does interest me, but really in terms of the gut, mucus layer and barrier support is why I think Akkermansia is amazing. They are doing a wonderful job of healing the gut, keeping the gut in a nice, tight, well-regulated space where there isn't food slipping through the gap junctions between the intestinal cells. So Akkermansia is a really wonderful keystone species, and it is, to be frank, one that I see pretty low or not detected at all in patients that come in with gut issues doing a gut test. There's a few other here, but in the interest of time, we're going to continue going. Fiber and polyphenols, these are some of the things that are feeding the different gut communities, as well as butyrate and short chain fatty acids. These are the postbiotics. You might have heard of prebiotics. You might have heard of probiotics. Postbiotics are what come after we have fed the bacteria. So we feed, we introduce bacteria in our gut from a probiotic. We feed that bacteria with a prebiotic, and once that bacteria has been fed with the prebiotic, be it a fiber or whatever substance we're using, they create postbiotics. Those are the short chain fatty acids, wonderful for creating that intestinal function and health, but also sometimes feeding the brain too. So some of the brain fog that comes from individuals who struggle with gut issues may be a reflection of poor short chain fatty acid development. So moving on to this latter half of question four, good bugs versus bad bugs. I think it's more complicated than that. I'm asking how much of what is present, what else is next to it, what is the immune system doing in relation to this particular pattern. It really does matter what we're looking at in terms of the symptoms, as well as looking at them in terms of the data coming from the stool test. So this is how we understand where a professional interpretation is, in my opinion, the best way to go, as opposed to looking at a report and saying, oh, I'm low on this bacteria, let me just supplement with more of it. That might help, but sometimes it's not about that particular bacteria being low, but it's the environment that's allowing that bacteria to not propagate, and really getting a full evaluation of symptoms with the stool test with a provider that is able to come up with a well-organized plan is where I see the most benefit for these gut patients. So question five, kind of the hook as to what led me to think about doing this webinar is, are there pathogens? That just because it was something that I think is been put into the media with higher emphasis lately, it doesn't mean it's not something to look into. Definitely still part of our routine gut testing. And in fact, you'll probably get a wider breadth of pathogenic bacteria when we're looking through these gut tests. like Genova, like Doctor's Data, Vibrant. They're going to be looking for pathogenic bacteria, parasites, other relevant organisms. I mean, we could be seeing yeast too. There is the potential for fungus to be causing bacterial issue or gut issues, and you may notice even it changing the foods you're interested in. You might have a higher sugar craving because of the yeast that's in your body, really telling your gut and that gut-brain axis to crave sugars, crave simple carbohydrates, and by doing so, essentially feeding and making the problem worse. So definitely want to highlight that the investigation of pathogens is still very vital for a proper gut test. So, could the problem be higher up? This is one of my favorite sections because just the colon, that's not enough. We got to be looking at the small intestine too. That is majority of where we're getting the breakdown of our foods and our absorption of our foods, as well as the stomach. The stomach is doing a fair bit of work to break foods down, but the absorption is happening in that small intestine. And what's going to stop you from having a good time in absorbing all those nutrients that you broke down? Well, it's an influx of bacteria in an area in the body that it shouldn't be. The small intestine should not be riddled with bacteria. That's why we call it SIBO, small intestinal bacterial overgrowth. And not every GI question is going to be answered by a stool test. Sometimes I am able to clinically understand what's going on with someone and essentially be aware of what type of SIBO we're dealing with. Potentially, we'll not go forward with the SIBO test and use the stool test to guide our treatment plan. But sometimes it's really important that we do a SIBO test and make sure we know what type of SIBO we're dealing with. Because SIBO comes with bloating, it comes with gas, it comes with altered bowel habits. But how those bowel habits have been altered is really where the testing comes into play. So SIBO isn't just one pattern. It includes all of those three things I mentioned, but there can be hydrogen SIBO, there can be methane-based SIBO, there can be hydrogen sulfide-based SIBO, and sometimes a mix of all three. Generally, normally not all three, normally one or two. But what we see with hydrogen, those looser stools, those diarrhea patients, still got that gas, still got that bloating. But compare that to methane, a lot more of a slower transit, a lot more constipation, just that ache from having impacted stool that does not want to come out, and that uncomfortability that comes when we're not engaging in one of our major detox pathways, which is utilizing our capacity to void through our bowels. So if we're constipated, it can be fairly uncomfortable. And if it's coming from a SIBO picture, it's likely methane induced, which is from an archaea. It's not even a bacteria. But nonetheless, we will treat it as such and implement kill protocols, sometimes with antibiotics, sometimes with natural products. For example, methane-induced SIBO does really well with allicin, the active particle in garlic, which is ironic because a lot of SIBO patients are told not to have garlic, which is good advice. But isolating parts of garlic and using it as part of the kill agent when we're trying to rid the body of the overgrowth of archaea is what might distinguish why I'm using this treatment plan from a methane-based SIBO individual to someone who simply needs berberine, that is a hydrogen-based SIBO. There's also hydrogen sulfide, and those tend to be a bit trickier to treat. A little bit more reoccurrence comes from the hydrogen sulfide, but it's also one of the more rare ones I see. Nonetheless, the point here is to highlight that there are gut tests that go beyond investigating stool. This is done through a breath test, ingestion of material, such that the way we break it down, when we do that breath test, it'll tell us, oh, are we having a lot of hydrogen growing in the place it shouldn't be, or produced in the place it shouldn't be? Are we having a lot of methane produced in the place it shouldn't be? So we're identifying the pattern, we're choosing the appropriate treatment strategy based off of what the results say. And we're considering also why did the overgrowth happen? And that last step is really what separates some SIBO protocols from others because remission and reoccurrence are a tricky aspect of SIBO, and we really want to stay in remission as long as possible. It's possible that you can have another reoccurrence of SIBO fairly soon after a treatment protocol if we don't get the motility, the digestive function, the medications that can be altering our digestive function. If we don't get those all in order and really take a look at that, we might just be going through the same SIBO protocol, and SIBO protocols can be fairly involved. So we don't like to do them too often if we don't have to. And then let's go even higher than the small intestine. What's going on with the stomach? We've talked about this a bit, right? Is our stomach acid high enough? Is our pH low enough? We need to help our body digests proteins from the stomach acid. It's going to help us support nutrient absorption by breaking those macronutrients down, and also important defense against ingested microbes. So reduced gastric acidity can be one of the factors that increases susceptibility to microbial overgrowth further downstream. If my stomach acid isn't strong enough, I might be allowing these microbes to colonize my small intestine before they even reach the colon. H. pylori, in some individuals, we have it and it doesn't cause a problem. In others, it's the reason that everything is going awry. H. pylori likes to change the environment of the stomach. It likes to make the pH more favorable for its survival, but that can alter the gastric productivity, the ability for the stomach to actually break foods down. And this is something that has been thought of as a cause of ulcers. More consistent research has shown that H. pylori in and of itself isn't a causative agent, but the alterations that occur within the stomach can result in ulcer formation, and that is sometimes seen in individuals struggling with H. pylori overgrowth within the stomach. So, point being, sometimes alterations in the stomach can lead to issues downstream, like the small intestine, like the colon. And this is why I'm careful with those individuals who need to use PPIs or proton pump inhibitors, histamine blockers. These foods that essentially are neutralizing your stomach acid, often because of acid reflux, are normally meant to be short term. There are the occasional cases where long-term usage is really important, and we can't move past that recommendation because of some concerns that can occur from chronic acid reflux issues. But managing acid reflux from the perspective of a naturopathic doctor doesn't always start with reducing stomach acid. Sometimes it comes from having not enough stomach acid. Having proper stomach acid allows us to break our food down, allows our food to go into the small intestine. It keeps our sphincter from the esophagus and stomach from getting loose. That is essentially a lecture in and of itself. But what I'm highlighting here is that sometimes medications like proton pump inhibitors or the famotidines, the H2 blockers, we are worried that they can cause an issue that is exacerbating the small intestine problems, exacerbating the colon. So I'll consider that too in terms of what's our dosage, what's our rationale for using these medications. Can the patient be moved away from them or at least titrate the dose down so it's not neutralizing the stomach acid to the extent that it is, while also keeping the reflux symptoms away. So that's a whole conversation in and of itself if we are concerned that stomach acid is part of the reason our gut symptoms keep reoccurring. Last question in this section is what about the gut barrier? We've talked about this a bit, but our gut is meant to also be protective, right? We want certain food particles to break through, but not large base food particles that are already essentially going to cause an immune reaction if they go in the wrong place. We want them to be small and just simple nutrients that our body is going to utilize and readily put into the bloodstream to travel to where they need to go. So intestinal permeability is sort of the cells being side by side and not being separated. And there'll be a better visual than just me using my fists coming up in the next slide. But that's what I'm trying to highlight is this leaky gut. If these two fists were intestinal cells, a normal gut has a nice connection between the two. But when there's damage, inflammation, irritation to the gut lining, separation occurs. And I'm exaggerating a bit because these are all, of course, microscopic. But really, what's keeping these cells together, we can take a look at this visual here, is proteins like zonulin. Zonulin is what's going to help those gap junctions, the ones that are meant to be just big enough for certain things to go through and enter our bloodstream, and certain other aspects of our food to stay in the gut and not leak into places it shouldn't be. That's all going to be kept together by having these proper proteins that help bind our gut cells together. Now, when we see zonulin raise, and we can see that through a gut test, we get suspicious for leaky gut. That protein going up in high levels can often lead to food particles entering regions of the gut that shouldn't necessarily have that type of food particle, and we get immune responses. This is where we have those IgG immune reactivity. It looks like you're allergic to the food that you're eating, but you're not quite having an anaphylactic response. Some of this can be driven by damage to the gut that leads to not only issues with voiding consistently, stool consistency, diarrhea, constipation, but also that irritation, that pain, that inflammation, that brain fog. All of these symptoms that can be coming from a leaky gut can occur because we're having these gap junctions compromised. And what causes that? A host of things: intestinal inflammation, GI infections, dysbiosis, celiac disease, SIBO, NSAID use, excessive alcohol use, just things that are damaging the gut, like stress, things that don't support the gut, like low fiber, and even intense exercise. I mean, these athletes who do amazing things with their body and push themselves to run long distances, those are the kind of individuals I'm looking at and saying, is your lifestyle affecting your gut? Is your quote unquote healthy lifestyle affecting your gut? Because that can be a reality. We do see these gut patients arise when they have a strong history of endurance. And I'm talking ultra marathons, real endurance athletes. But even those who are running the half marathons, I mean, that's no small feat. So we have to be thinking, is that length of training, running, constantly spending multiple hours in the day with blood flow going to our tissues as opposed to our gut tissues, is that leading to some kind of compromised gut barrier? So very important question to ask, and a stool test can show it. So we're gonna have to breeze through this last part, but let's connect the dots. What I want you guys to take away from today, putting all the little bits and pieces together of how our gut functions and why gut tests can show us how to optimize that function, is asking the question of not just who, but what. It's not just who's in your gut, it's what are they doing in there. A comprehensive picture of the gut health goes beyond identifying just what's in there. We're not playing guess who, that's part of it, but we're actually asking what are these individuals saying, communicating, doing to each other to make this ecosystem actually properly function. And so going beyond that, it's not just who lives there, it's what they're doing. This is breaking down dietary substrates. Do we have the right microbes to process different fibers we're introducing to our body? Are they producing the right type of metabolites? Are they interacting with our immune function? Participating in the gut environment the way that we'd like to? Are they helping with our intestinal lining? Like I mentioned, Akkermansia, going to be helpful for those with a leaky gut issue. A microbiome is more than a list of bacteria. It's a functioning ecosystem. That's a big takeaway I want you to have. And also, when you eat, you're feeding more than yourself. That's the prebiotic conversation we had. The oats, the legumes, the vegetables. It's not just fibers that we think of when we're trying to bolster bulk our stool up, but we're also trying to feed our gut microbiota. And our microbes are meant to ferment it, mainly in the colon, not in the small intestine. That's where that small intestinal bacterial overgrowth occurs. But if they're fermenting in the right place, my gosh, what wonderful metabolites they make. The butyrate, especially, important fuel source for cell linings of colon. They help with maintaining that intestinal environment. So your gut microbiome, it doesn't just live in your gut, it does its work there. It's not just existing, it's actually working for you. And your gut in general does more than digest your food. Your gut may help decide what happens to your hormones. It's an entire lecture in and of itself. But quickly put, estrogen is something that our body needs to be managed. We need to have it in a homeostatic balance, both men and women. We can't have excess and we can't have deficiency. The liver's job is to process estrogen and prepare it for elimination. So bile being released into the intestine is going to package it for removal, deliver to the digestive tract. And in a normal exit route, it's going to be eliminated through the stool. But we can even see through gut tests increased microbial enzyme activity from dysbiotic bacteria, from an imbalance of bacterial overgrowth, or just overabundance of certain bacteria that are upregulating the enzyme beta glucuronidase, which is a marker in our stool that shows us increased enzymatic activity for recirculating that estrogen. So if we're not properly excreting the estrogen and we just keep recycling it because our gut is out of balance and we're overly producing this enzyme, you may be a hormonal patient that doesn't even think they have a gut problem. And you come to a naturopathic doctor who is in love with doing stool tests and they go, come on, we got to check this out. And you go, okay, fine, fine. And you look and wow, this is where my hormone issue is coming from. My gut is just not detoxifying the way it should be and getting rid of the excess estrogen. So that's one angle as to how hormones and gut are aligned. There's also the gut-brain communication. I think we've all heard more and more about how much serotonin is being produced in the gut. We know about the gut-brain axis. Any gut patient will know that their mindset and their stress levels can alter their gut, and vice versa. Their gut symptoms can flare and cause depression and mood issues and anxiety. Um, I've been bloated myself and struggled with my fair share of gut issues. And I can't tell you the amount of times I've been sitting here feeling good, everything's fine, and maybe I ate something funny, or I don't know, all of a sudden my gut starts swelling up and I'm bloated, and then now I'm anxious and I'm uncomfortable and I'm irritable, and oh, it's because of this gut-brain connection. So just quickly going over that to let you know that your symptoms outside of the gut may be reflective of your gut health, and what we can do to fix those symptoms can also be coming from what we do to fix the gut. So, which gut test should you get? Comprehensive stool test, microbiome test, SIBO test. Oh my God, parasites. There's so much to talk about, right? Well, it's depending on the questions we're asking. So, the best test is the one that helps us answer the right question. That comes from doing a proper intake, going through an individualized approach. Let's take this case study, for example. I've been bloated for 3 years. I've tried to remove gluten. I've tried to remove dairy. They've tried probiotics, enzymes, supplements. They sometimes feel better, but sometimes the symptoms return. Oftentimes, this type of patient is going to be told they have IBS, which may be the case, but not always the case. So they still just don't understand what's happening. And what am I going to do to investigate it? What would you do to investigate it? Well, this is some reports just so you guys get an idea of what these gut tests look like. But this is one from Genova. First page goes into depth, probably a 13-page document. But right here, it's already showing, well, we're not really breaking things down well in terms of our pancreatic elastase. We could be using a little bit more beneficial digestive enzymes. We are heavily inflamed, my goodness. Potentially, sometimes this can even lead to us being aware that there might be an IBD diagnosis, dysbiosis. Oh my gosh, the methane score is through the roof. Maybe we want to do a SIBO test. Maybe we feel confident that we know what type of SIBO this is, and we just want to start treating the gut and getting into a proper kill protocol. Infection, there's a parasympathetic infection. They are scored 10 out of 10. So that's just one example of kind of that first page overview, and then working with your provider to break down what these results really mean in terms of treatment. Doctor's data. Here's another example of what a stool test might look like. I think I discussed how there are different families that multiple microbiota might be part of. So this is sort of showing the distribution of the different families in this person's gut. Mainly, they're over here in the actinobacteria, the firmicutes, but they are lacking some of these family on the right. So all of this can be very beneficial for telling us, what is going on in the pattern with the gut. Okay, and you know, I have to speed through this next section too. This lower picture right here is just showing the results of what a SIBO test might show. You can see this dashed line is representing what a normal amount of hydrogen in the gut might be. But after provoking hydrogens via a SIBO breath test, we see those values rise in someone who has that bacterial overgrowth inside the small intestine. And likely this is going to be a hydrogen-based SIBO case where diarrhea is very predominant in their symptomatology. So really, these are come back to this in the recording because we're gonna have to speed through this, but these are the host of different gut testing we do at RHMC. There isn't just one gut test, and it's my job as a provider to think of the best gut test for you. Sometimes there's a copay with insurance, so cost is definitely always a consideration, and that might be a reason why we pick one test over the other, because some of these tests are really going to tell us enough information, and it just might come down to what's going to be the best test for the patient, given something like cost or return time, how long it takes for the gut test to come back. This is kind of a system that you might think of in terms of collecting system plus history, appropriate testing, interpretation, and then coming up with an individualized strategy. And we're considering all those components we discussed earlier in terms of the functionality of the gut, the intestinal barrier, the motility support, on and on, right? So who might benefit from looking deeper? You've been bloated for months or years. You've been told you have IBS. You don't understand why. Keep eliminating more and more foods, more and more of a restrictive diet. Probiotics sometimes make me feel worse. Symptoms keep coming back. And maybe you just feel like you've tried so many things, but you've just been guessing. And you might be ready. You might be ready for meeting with the doctor, getting a sense of what really is happening, getting some objective measures in the gut, and seeing what we can do to treat and come up with a wonderful plan so that you are in remission. So sorry we had to speed through the ending here. I clearly love talking about the gut. I think the gut is the doorway to a lot of healing potential in individuals. So whether you're dealing with gut issues or any health issues in general, I see patients for adjunctive oncology, mental health, men's health, a variety of different conditions here at Regenerate Health Medical Center. Dr. Ace, our fellow doctor, does plenty of with women's hormones, mold, chronic illness. Please take a look at our YouTube channel. Look at our many webinars that we posted. We are doing these free monthly webinar recordings. We post the live stream up onto the YouTube. Their health education, their functional medical insights. We also have these shorter, more bite-sized, digestible Instagram clips that you can take a look at by following us on Instagram. But feel free to contact our front desk if anything that I said today resonated with you. We do offer complimentary discovery calls to see who might be the right fit for you in terms of which doctor you want to go with, in terms of if my treatment ideology and treatment approach matches what you feel would benefit your case. But again, like I said, your health starts with being curious, being willing to make changes, and really being optimistic that there are solutions out there for you. So, unfortunately, I don't have time for questions today. But if you have any further questions about scheduling an appointment, feel free to call the number below or visit our website, regeneratehealthmc.com. Thank you so much for your time today. It's wonderful to chat with you guys. We'll do another monthly webinar next month in September, but this was our August one. And thank you for coming in. I'm going to have to end the webinar now. And I hope you have a great rest of your Wednesday. Thank you, guys.